So, here I will try to explain quickly why, in a patient with obstructive airway disease like cystic fibrosis, asthma, not always by increasing the rate will, end up by having a low CO2. Because sometimes you can decrease the rate to get the better E time and you can have a lesser CO2. So, what happens? Suppose in this patient you are giving before a respiratory rate of 50 and I time was 0.45. So you have to calculate breath cycle time, which was in this patient, because patient in in 1 minute there is 60 seconds and patient was on 50 breaths per minute. So you calculate one breath cycle time 60 divided by 50, and which is like 1.2 approximately. And in that patient, in that scenario, the expiratory time you can calculate total breath cycle time minus your I time, which was 0.45. So basically you have expiratory time of 0.75 at that time. So what we have done in that patient, what we have done that we have decreased the respiratory rate to 35. I time was the same 0.45, and now you calculate breath cycle time with 35. So 60 divided by 35, so this round comes like 2 seconds. So now you can calculate expiratory time by 2 minus 0.45. So E time in this patient is around like 0.55. So if you can see now, previously your expiratory time was very less, like 0.75, and by decreasing the rate, actually your expiratory time is increased now 1.5. So this is the time, expiratory time means this is the time where patient need to exhale his or her CO2. So in obstructive diseases, especially like cystic fibrosis or asthma, sometimes you have to decrease respiratory rate to get the better CO2 clearance, because once you are decreasing the respiratory rate, actually breath cycle time, you are giving more expiratory time. So you are giving more time in a respiratory cycle for CO2 clearance. I hope this will, you guys will understand.